She is our special guest here and our host today, looking particularly beaming and happy because today is a very significant date on a long journey for this organisation and this fund. That she's been the driving force, or you can say she's shown exemplary leadership on this, or as someone said, this is basically the Minister's baby. So whilst we still wait on bated breath for the royal baby to come, today we deliver the Minister's baby through the Medical Devices Fund and the announcement. Please, Minister, come and tell us a few words about this. The Minister for Health and Medical Research, Gillian Skinner.
Thank you very much indeed, Adam. May I start by also acknowledging the traditional owners of the land that we gather on and pay my respect to Elders past and present, and thank you, Uncle Alan, for your warm welcome, to Dr Chris Roberts of Cochlear, Dr Mary Foley, Professor Mary O'Kane, my good friend Peter Wills, who's in the audience there, other members of the judging panel, Dr Bob Frater, Neville Mitchell, Adam Spencer and Michael Still. Can I say that this really is a very exciting day for me. I had a dream about doing this many, many years ago, and can I say that this day this event is a fruition of a dream I've long held, and I'm sure it will long remain as one of the highlights of my career as the Minister for Medical Research. I've for a long time been excited about the prospect of helping some of our wonderful inventors get their brilliant ideas to market. I confess that it was Cochlear that inspired me to develop the Medical Devices Seed Fund policy for the last election. I had visited Cochlear's manufacturing plant many, many times over the 16 years I spent as Shadow Health Minister. I'd attended functions, I'd been present to see the joy on the faces of parents as their children heard their voice for the first time. It really, and I don't mind telling you, brought tears to the eyes every time I saw it, not just the first time, but every time. So in launching our policy back in February 2011, I acknowledged the significant contribution made by medical device companies such as Cochlear. So it's fantastic, Chris, that you are hosting this event here in Cochlear's new home, and I thank you most sincerely. Globally, the medical technology market is estimated to be valued at over $300 billion US per annum. The Medical Technology Association of Australia estimates that the total revenue for the national medical technology industry in 2010-11 was $10 billion. Growth in the medical device market is expected to continue. New South Wales has long been a world leader in the area of medical devices. A number of internationally recognised medical device companies are located here in Sydney, with about half of Australia's medical devices industry located in our state. As Glenn Cross, then Chief Operating Officer of AusBiotech Limited, had pointed out, and this is a quote I used when I launched this policy back in 2011, the success of such companies is a byproduct not just of the entrepreneurship, ingenuity and persistence of the individuals involved directly with those organisations, but a critical mass of expertise and interest in the state of sufficient to form the engine room of a globally sustainable, growing, competitive industry. And that's what I hope we're on about in this seed fund. Medical technology is a competitive and highly innovative market. In Australia and internationally, healthcare systems are coming under pressure from the increasing needs of an ageing population and from chronic illnesses associated with advanced economics. Quality medical devices have the potential to not only transform the diversity of healthcare, but to delivery of healthcare, but to deliver the life-saving benefits for patients and comfort for their families. However, the road to commercialisation is fraught with challenges, which is why we made the establishment of a Medical Devices Fund a commitment before coming to government. I was pleased that the New South Wales Health and Medical Research Strategic Review 2012, conducted by Mr Peter Wills, recommended that the Medical Devices Fund do two things: provide support to individuals, companies, public and private hospitals, medical research institutes, universities, other public sector research organisations and the medical devices industry to take local innovation to market and as well to increase the uptake of New South Wales medical devices by the health system where they are cost effective and contribute to improved patient outcomes. Well said, Peter Wells. So in government, we have made an annual investment of $5 million to the fund, which for this inaugural round is in excess of $10.3 million. The New South Wales Government recognises that investment in research, including the development of medical devices and technology, takes innovative clinical care from the bench to the bedside and has a myriad of benefits for the patient. The New South Wales Government's commitment to health and medical research has been demonstrated through our investment of an additional $70 million over the next 4 years to fund key research and development initiatives. This takes our investment in health and medical research to more than $200 million per year. I'm delighted that almost 150 expressions of interest were submitted for this first round of the Devices Fund, and I'd like to thank the fund expert panel led by the New South Wales Chief Scientist and Engineer, Professor Mary O'Kane, for taking on the daunting task of reviewing these applications. Selecting the 5 final successful applicants took considerable deliberation and careful assessment, and I want to also thank Tony Penner and the team at the Office of Health and Medical Research in the Ministry of Health. Today's recipients will be pivotal contributors to building the commercial success of medical technology and better health for patients in New South Wales. This will pave the way for generations to come. I am passionate about health and medical research and ensuring innovations that arise from it are translated into better health outcomes. I'm honoured to be here today among these inventive minds celebrating the achievements of the medical devices sector in New South Wales. I commend all involved in this creative field for the vital work that you do. I look forward to hearing how the Medical Devices Fund has accelerated the development of these technologies for the benefit of generations to come. Thank you all for your involvement today, and I want to end by thanking the expert panel, and I'd like them to stand if they would. Adam Spencer, you know, Michael Still, Mary O'Kane, Neville Mitchell, Bob Frater. Can we please give them a round of applause?